morning, and thank you for joining us for the Ministry of Health virtual media conference on the national COVID-19 response for Wednesday, 29th December 2021. We will be providing you with the latest update, and we have the Honorable Terence Dialsing, Minister of Health, and Dr. Roshan Parasram, our Chief Medical Officer, Ministry of Health. I am Al Alexander, Senior Corporate Communications Officer in the Ministry of Health, and I will moderate this morning's conference. We begin with the CMO, Dr. Parasram, who will provide the latest clinical statistics for the parallel healthcare system and an update.
Hi, good morning. Thank you all. Good morning to the Honorable Minister. Good morning to members of the media, members of the viewing and listening public. So we begin, as usual, with the COVID-19 update for the 28th of December, 2021, which is yesterday. Total number of tests conducted thus far, just over the 500,000 number, 502, 121. Total new cases reported over the last 24 hours, 360, taking our tally since the 12th of March to present to 90,364 confirmed positive cases. Total persons recovered thus far, 71,052. Total active cases, 16,503. And those persons in home isolation as a subpopulation of that group at 15,505. Total deaths so far stand at 2,809, and condolences to the families of all of those who would have lost loved ones, 16 of those over the last 24 hours. Total persons in hospital, and I'll break it down further, 484, and in step down 154. And if you could go to the second part of the presentation, we're looking at a breakdown of the 484 persons in the hospital. At the Couva Hospital and Multi-Training Facility, 114 individuals, 23 in ICU, 22 in the High Dependency Unit. At the Cora Hospital, 52. Augustus Long, 54. St. Anne's Hospital, 10. Arima General Hospital, 72. New Point Fortin Hospital, 85. St. James Medical Complex, 55. Scarborough Regional Hospital at Fort King George, 36. And Scarborough General Hospital at Signal Hill, 6 persons at this time. If I could go to my second presentation, which is a very brief update as to where we are globally with the Omicron. If I could have the first slide, please. So if you go forward, we'll see as the slides come up. Go to the third slide. Next one. With the third slide, will show as of December 23rd, Omicron has been identified in 110 countries thus far. The overall risk related to Omicron remains very high in terms of spread. Consistent evidence continues to show that the variant spreads faster than Delta with a variable doubling time somewhere between 2 to 3 days, and that is in very large countries. It has happened in the UK and in South Africa as well. Omicron has become the dominant variant in countries such as the United Kingdom, South Africa, and now in the United States of America. Next slide. So just to look at the UK in terms of their number of cases, as of December 28, 2021, the UK has now confirmed 177,201 cases of this particular variant, again becoming dominant very quickly. Next slide. Having a look at South Africa, we had spoken about South Africa. What we're seeing now is actually a downtrending in the number of cases of COVID-19 in South Africa as observed compared to early December, late November, which is a fairly short timeline. In terms of that decrease, it must be borne in mind that, of course, there would be a change in public behavior as it relates to public health measures, and there may have been some implementation of restrictions in that particular jurisdiction, but there is a decline in the number of cases seen in South Africa. However, other countries which were close by, Kenya, Malawi, and the Democratic Republic of Congo, are now seeing large increases in this particular variant. Next slide. So this slide is basically just to reiterate the symptoms of COVID-19. So we just have a look at it again, but preliminary data doesn't indicate that there are unusual symptoms for this particular variant. However, there are anecdotal studies coming out from different parts of the world that suggest symptomatology, for example, in terms of dermatologic manifestations. There may be some signs that we need to keep a close eye on in the coming weeks and days. So just to reiterate, the signs and symptoms of COVID-19: fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Certainly, in terms of shortness of breath and vomiting, if you're having those severe manifestations, you should seek healthcare right away. Next slide. So, the emergence of Omicron and other variants like it further emphasizes the importance of getting all your recommended vaccine doses, including a booster when it is made available and when you are due to have it. Next slide. And of course, it underscores the importance of the 3 W's, which is wear a mask and wear it appropriately over your nose, mouth, and chin. Watch your distance and wash your hands. And the last slide will tell you, in terms of the 3 W's, it helps to protect you from infection and reinfection, to protect others, including ones you love the most, to prevent the formation of new COVID-19 variants, and to break the chain of transmission. So we're asking everyone through the Christmas season and into the new year to be responsible, practice the 3 W's, and vaccinate as soon as you can. Thank you all.
Thank you very much, CMO. The Honorable Terence Yelsing will now present the latest vaccination figures.
Thank you, Al. Yes. Good morning to the Chief Medical Officer. Good morning to ladies and gentlemen of the media and the citizens and all in Trinidad and Tobago viewing in. I hope everyone had a good Christmas. And as we look forward to ringing in the new year, we continue to ask persons to be responsible in how we celebrate the old years and ring in the new year. So, the vaccination figures, as you know, we had a little lull over the Christmas weekend, and we started back yesterday at our mass vaccination sites and the health centers. Yesterday, between first shots, we did 1,411. When you add that to the J&J one shot and done, which was 331, you are doing roughly 1,742. We haven't seen this level of activity since around October the 18th. So it is about 2 months ago, we had this level of vaccination activity for both first shots and J&J. It's a good sign, but bear in mind, this is an improvement over a low base. So let's not get too carried away, but we could do a lot better. We are grateful for persons coming out, but we could do a lot better still. Total persons fully vaccinated, 666,432, which is about 47.6% of the population of Trinidad and Tobago. The booster program, which again restarted yesterday. Yesterday we did I think about possibly the most boosters since the booster program started. We did 2,760 shots yesterday. So our total population who were eligible to be boosted in this first month of the booster program now stands at 69,739. So 69,739 persons of this first cohort of eligible persons to be boosted are in fact boosted. By around Wednesday next week, we will come to the population to roll out the second phase of the booster program. The first phase ends on Friday, the 7th of January, as you know. So persons who are eagerly waiting to be boosted based on when you got your last shot, your turn will come very soon, and we will roll out those dates for the second month of the booster program by Wednesday of next week. We have been in talks to activate 2 separate sites, especially for public officers. They will be up and running from Monday the 3rd of January. One will be at the government campus plaza on St. Vincent Street. That site was activated a couple months ago when we were encouraging public officers to come out, so they are familiar with that site. That will be dedicated solely to public officers to make it convenient to them, for them. And we'll be dedicating 2 separate lines at SAPA, especially for public officers again. So any public officer who wants to be vaccinated from Monday, you have these 2 dedicated sites for you. However, you can still go to any site today, tomorrow, to be vaccinated. The MassVac sites will be open today, tomorrow, but they will be closed on Old Year's Day and New Year's Day, and we restart on Monday the 3rd of January. So you can still go out at our 109 health centers today, tomorrow, and Old Year's Day to get vaccinated. Our MassVac sites are open today and tomorrow, and then everything starts back on Monday the 3rd, full steam ahead. Let's save some lives. From a Ministry of Health perspective, the main reason for being vaccinated is to save lives, save yourself from decreasing your chance of getting COVID, decreasing your chance of being hospitalized, and significantly decreasing your chances of dying from COVID-19. So Al, thank you very much, and we can now take questions.
Thank you very much, Minister. We now move to the question and answer segment, where we invite members of the media to pose questions to the panel. All media representatives are asked to state their name and the name of the media house before posing your questions. We'll take 2 questions per media house during the first round of questions, and we will field additional questions from the media once the time permits. Kindly pose 1 question during all other rounds of questions. Again, today is Wednesday, so please note that during this segment and every other Wednesday, we will be taking a few questions submitted by MAT, as the Media Association of Trinidad and Tobago, relating to the national response to COVID-19. We'll take our first question from Guardian Media Limited. Good morning.
Good morning. The CMO. Yeah, my both questions are for the CMO and the Minister of Health. Firstly, in the United States, the CDC would have advised that PCR tests no longer be used, and that is supposed to take effect, I believe, on the 1st of January. Now, considering that many of our travelers come from the United States back and forth, is there going to be any accommodation made for that change within the TT Travel Pass, which only recognizes PCR tests? And my second question is, will we or do we have any sort of plans in place for expanding our testing capacity, probably reducing that time frame, because we are surging right now. We're expecting a surge into the new year, and when that typically happens, there's a bit of a backlog when it comes to testing. Thank you.
Okay, thank you. I'm not sure that the US doesn't have the capacity to do PCR. As far as our requirements for entry into Trinidad and Tobago, it remains the same. They require 72 hour PCR 72 hours prior to entry, and that requirement stands for now. I think the requirement for entry into the US allows for antigen, if I remember right, within 24 hours. But there is availability in the US, as far as I know, for PCR testing to continue. In terms of our national testing capacity, we do have capacity in terms of spare capacity at this point in time. Generally, when we go into large spikes, you find that there is a slight delay in terms of the timeline for reporting and everything that goes with it as the number of cases increases. But we are putting systems in place even at the CMOH level. We have got additional staff so that we can actually reach out to persons quickly to get their results to them, and looking at the entire process from start to finish, from swabbing all the way back to the patient, to see if we could tighten up that a bit with getting additional staff into the mix so we can clear some of the backlog that exists.
Thank you very much, CMO. We quickly move to the Newsday for your 2 questions. Good morning.
Hi, good morning. This is Paula Linda from the Newsday. My first question is for the CMO. The unions have asked for clarification as to how COVID-19 deaths are classified. Could you clarify if the people being listed in the COVID-19 statistics died because of complications from the disease, or because the disease exacerbated pre-existing conditions? Are people who died from other conditions, even murder victims, but also tested positive during autopsies, being listed as COVID deaths? And then for the minister, I wanted to ask, you initially said the 3rd primary doses were not boosters, but the Ministry updates refer to third primary doses and boosters in data. Is it that people who got third doses are also getting boosters, and what now is the difference between the two? Thank you.
Yeah, thanks. So I'll take the second question first. So when we started the third primary dose, we would have done about 20-something thousand. And then when we launched the booster program, we indicated at press conferences that eventually we'll amalgamate both figures. And the figures I am giving you, which is 69,000, is a combination of the third primary dose and booster as we move full speed ahead into a booster program. I'm glad you asked that question because it gives me an opportunity to say that from next week, we'll be readjusting our dashboard that we publish to indicate that. We have been getting feedback from the public and some members of the media, for which I'm grateful, that as the disease evolves, some information may no longer hold the importance that it used to have. For example, and this is worldwide, do we still need to focus on first shots versus what the world is focusing now is on the fully vaccinated and the boosters. So we are going to be making some adjustments to our dashboard from next week, but we'll alert you beforehand as we do that. And that is reflective of the question you are asking. So the 69,000, which I quoted, is a combination of boosters and the additional primary shots, which we started off with. Okay, Paula? So thanks for asking the question.
Okay, so in terms of your clarification on how we classify the deaths, generally speaking, and as we said before on this program, anyone that has passed away and has a COVID positive test at the time of death will be classified as COVID positive, dying with COVID positive. Anyone that would have had COVID being positive and then been hospitalized, for example, and passed away, what happens is that the clinicians make a decision and they put on the death certificate what they think is the cause of death, and that is what is generally utilized based on what the clinician sends to the ministry's central repository, which is the EPI unit under Dr. Hines. We use that data that we get from the clinicians to make a determination. They actually say that the person has died of some complications of COVID. So we use both categories together, add them together, and that's how you get deaths. We have cleared up that it's both persons dying of complications of COVID and those dying and having a positive PCR test at the time of death. So that's how we classify in the Ministry of Health.
Thank you, CMO and Minister. EZP News, we are ready for your two questions now.
Good morning, Prior Bihari, EZPnews.com. I wanted to ask the Minister, firstly, Minister, we are in the second year of a pandemic. I wanted to find out from you what grade you'll give yourself in terms of managing this pandemic. And I also want to pose that same question to the CMO and of course to Al also. Thank you very much.
Thank you, Prior. So Prior, when you say we are in the second year, it is not Trinidad and Tobago alone in the second year. The world, Prior, the global community is in the second year of a global pandemic. One headline on BBC, US reports COVID record as Europe's cases soar. I think it is not wise at this point in time to offer grades to any country as to how they have done. Countries around the world are struggling now, as you rightly said, into the end of the second year and the beginning of a third year. If you pay attention to CNN, BBC, Al Jazeera, the world, all 190-something odd countries are grappling with this disease. The Omicron variant is taking over countries. There are hospitals in other countries that don't have room. CNN reported this morning a 50% increase in pediatric cases. How do we grade them? So, trying to offer grades at this point in time, I don't think is productive. I think what we need to do is use our collective voices to ask persons not to congregate and to get vaccinated so Trinidad and Tobago can give itself a proper grade. If we do that, then we could decrease the number of positive cases, decrease our 7-day rolling average, decrease the number of people in hospitals, step down, dying. And that is the grade I would like Trinidad and Tobago to get based on the 3 Ws and vaccination. Thank you very much, Brian.
Thank you, Minister. We move to 103 FM. We are ready for your questions. Good morning.
Good morning, all. This is Sarah Chandu from 103 FM. My first question is to the Minister. Can you please respond to reports that plans for the Freeport mass storage facility have been scrapped, and what is the next step in this regard? And my second question to Dr. Parasram, can you give us an update on the status of all those who would have contracted the Omicron variant in Trinidad and Tobago? Thank you.
Thank you. So, in responding to your first question, I think Mr. Belgrove has spoken clearly on the issue. It is a private sector initiative, and based on what I saw him say on the news broadcast last night, he is looking for an alternate site, and as soon as he has a site, he will make that announcement to the general public. So I can refer you to Mr. Belgrove on that, which was a private sector initiative. Thank you very much.
So far, we have reported 11 confirmed cases of this variant of concern in Trinidad and Tobago. Manifestations in terms of clinical manifestations go all the way from asymptomatic to mildly symptomatic so far. It's a very small group of people, so we don't want to jump to any conclusions in terms of the severity of the disease or anything else from this particular cohort, but just to say that we have confirmed 11 so far, as the press release would have said, and they all seem to be doing well clinically at this point in time.
Thank you very much, CMO. And Minister, TV6, good morning. We're ready for your questions.
Hi, good morning. Alicia Boucher from TV6 News here. Season's greetings to the entire panel. My first question is to the CMO. CMO, you just classified how COVID-19 deaths are, well, you just stated how those deaths are classified. But we've seen people coming out, as well as entities, most recently NATAC, having a problem with how those deaths are being disaggregated. So I wanted to find out if we had to disaggregate the deaths in a different way, let's say, because some people, whether you might have like a positive PCR test but very mild symptoms, should that really be classed as a COVID-19 death? What is the logic behind classing that as a COVID-19 death? And if we had to use a different process in terms of using the pathology or symptomology, whichever one, in terms of, if we had to use that process, what would it take, and do we have the necessary staffing and so on to do that? So that's my first question. Second question is to the Minister. Minister, do we have any update on the actual figures? It was stated that 100 nurses had left the system. I was just wondering if you have any updates on the actual figures for that report. Thank you.
Thank you. So, Alicia, I really want to appreciate and thank you for asking that question about the nurses, because that newspaper headline was so misleading, and I continue to be taken aback by how we discuss matters in health. So I asked all the RHAs to give me their numbers. The breakdown is as follows. Now remember, people will leave places of employment for a variety of reasons. In the case of nurses, it could be because they move from one RHA to another, they resign from one, go to another. 2, yes, some migration takes place. 3, maternity leave. 4, retirement. So all those reasons will contribute to the numbers I'm going to give you now. From each RHA, number of persons who have left, 12. But what is never discussed is how many come into the system. So numbers at each ERHA that came in is 94. So you had a net gain of 82 persons, and that was not, that side of the story is never told. NCRHA, you had a net gain of 43 persons. 46 would have left for various reasons, and 89 would have come in, recruited. So a net gain of 43. Northwest, you had a total of 216 persons leaving for all the reasons I have discussed, but you had a net number of recruits of 285. Therefore, you had a net gain of 69. At Southwest, you had 59 leaving for various reasons, but listen to this. 284 new nurses were hired, giving you a net increase of 225. So I just ask everyone to be cautious and just give both sides of the stories. So the total number of persons coming into the system has far exceeded the total number of persons leaving the system for various reasons. In addition to that, Alicia, just today I would have signed on to the recruitment of 40 extra Cuban nurses, remembering that we had brought in 25 Cuban nurses around October of this year. To add to that, Alicia, you have to look at also to get a complete picture of what is happening as far as training of new nurses is concerned. For the 2019-2021, there was a total intake of 7,227 students. Total graduated 2019-2021, 410. And I am told that almost each of those 410 have been incorporated in the public healthcare system. So I hope that gives a more holistic view of what is happening with both nurses retiring on maternity leave, inter-RHA transfer, and those who are migrating. But the way the story was carried, it painted a different picture because it didn't go in. These sort of details were not sought. It took a couple days for us to get it, and I am very, very happy that you raised the issue so I could put that, that story to rest. Thank you very much, Alicia.
Okay. Yeah, so I'm not sure. I'll go over the definition again to see if we can clarify it for you in a little more detail. So generally, there's two main categories. So persons that would die with COVID and those who would die of COVID, meaning of the complications of COVID. So we have two broad categories. Persons who would have died in hospital would be given a death certificate from the clinicians in the hospital on that side of it. Persons, for example, that would have died at home, having known their status prior to death, would be classified by a district medical officer or the attending physician, and then that data will come upstream to the Ministry of Health. As it relates to the unknown deaths, for example, somebody collapsed at your home, they would not have been swabbed before, they don't know the status. What happens is when they come in and they're brought into the institutions, they are swabbed at that point, and we count those as persons that would have died as having a positive swab at the time of death. So those are the broad categories that we try to capture in our data, and we try not to miss anyone that would have died in Trinidad or Tobago and been, at least we would have tried to capture everybody in the country. And through the system we have with the Trinidad and Tobago Police Service and the district medical officers, they are responsible for all deaths outside of the hospital. So we think we cast a very wide net and we're able to capture all the deaths inclusive of everything that occurs outside the hospital.
Thank you for your responses, CMO and Minister. We now go to the Express. Ready for your questions.
Good morning, Camille Hunt, Express. My question is to the Minister regarding the issue this weekend where we saw a gathering on board a vessel. Minister, the organizer of the event had written to you requesting permission to operate the vessel as a restaurant and as a safe zone. So I'd like to know what was your response to that request and if you did give permission for the event.
Thank you. So the letter did not seek permission. The letter informed me that they were doing this. So let me clearly state under Section 8 of the Public Health Rules, and we said this when we launched the Safe Zone initiative, that once you download the poster that you put up, that is all you need to do, and you have agreed to operate as a safe zone. The minister nor the ministry does not give permission or authorization to operate as a safe zone. And let me correct what you asked. The letter did not ask permission. The letter informed me that they were going to operate as a safe zone. And neither the minister needs to be informed as such or seek authorization or permission to operate as a safe zone. And that could be clearly found in Section 8 of the Public Health Regulations.
Okay, Camille, did you have a second question? Okay, so we move to TTT. TTT, we're ready for your questions.
Good morning. Terry Ann Brown Campbell from TTT News. Merry Christmas to the panel. Season's greetings. I have two questions. The first question is for both the minister and for Dr. Parasram. This being the second Christmas, healthcare workers have been working continuously to fight the pandemic. How is the Minister of Health doing? How are healthcare workers doing? That is my first question. My second question is to the Minister. What is the current level of vaccinations among healthcare workers, nurses, doctors, and other forms of healthcare workers? Thank you.
Thank you very much for inquiring after my well-being. I think that's the first time anyone has done that. I do appreciate it. I am doing fine. I think all of us have found ways to manage ourselves. Healthcare workers, as you know, I visited about 10 facilities over the past week, and as I said, and it was carried about in newspapers, healthcare workers are tired, and it's a global phenomenon again. They are just tired, and we don't have replacements for them, and that's why I continually ask the public to help us out by not congregating, not infecting yourself, and so on. So they are tired, but they come out every single day to do their duty to Trinidad and Tobago. And I personally congratulated all of them when I visited sites. We would sing carols for them. We will give them little tokens of appreciation. And I am not only talking about doctors and nurses. As I said, I went into the belly of the beast. I will visit the mortuary in Point Fortin Hospital. I will go to the linen department, housekeeping, clerical, HR, security, landscaping, sanitation, housekeeping. All of these people are important in the battle against COVID-19. Now, vaccination numbers. So, from the start, we dedicated vaccines to healthcare workers. The doctors, as we have said several times, are about 95 to 98% vaccinated. Nurses across the board roughly were about 65, but you would have heard Davlin Thomas say on Christmas Day that in his RHA, healthcare workers as a whole, I'm talking across the board now, went up from 45 or 48 to 65. We are seeing the two RHAs that we are concerned about in Trinidad are Northwest and North Central. Southwest, before this drive, was about 80%, so they have to make incremental increases. Eastern was 71%, so they have to make incremental increases. But Northwest and North Central are two that we have to pay particular attention to. The TRHA Tobago was about 50%, so we have to work with them. So the three RHAs that we have to make special efforts for to increase the vaccination rates across the board, except for maybe the doctors, we are at about 95, 98%, will be TRHA, NCRHA, which has since picked up, and Northwest RHA. We are literally going door to door, person to person, ward to ward, department to department, giving them the information so that they can make an informed decision. So thank you very much for the question, and thank you for seeking after my well-being. I really do appreciate it.
Thank you very much, Minister. We will now be taking follow-up questions, and we start with Guardian Media. Yes, Richard, go ahead.
Yes, thank you very much. A little slow on the draw there to unmute. So, Minister, based on the response you would have given there to my colleague about the party boat, is it then that now any party boat could just put up a safe zone sticker and operate as a safe zone? Because if I'm remembering correctly as well, Regulation 4B, I believe it is, that says just simply operating a party boat is against the regulations. Thank you.
So I would advise that the application of the regulation lies with the TTPS, and I will advise that all these questions as to how the safe zone is to be implemented is a matter that lies with the TTPS. In this particular case, as you know, both the TTPS and the DPP are involved, so the regulations are there for interpretation by the TTPS.
Thank you very much, Minister. Newsday, good morning again. Ready for your follow-up question.
Hi, good morning again. So my question is for the CMO. Could you tell us what the outcome was of your meeting with the THA Health Secretary on Tuesday? Thank you.
So that is a question for me as Minister. It was my meeting. The CMO was present. So we did meet yesterday at 1 o'clock as promised. It was a very cordial meeting. It was mainly an introductory meeting to introduce for both myself and the new Secretary of Health to introduce ourselves to each other. Also, what was important was for the permanent secretary to be introduced to the new administrator in the TRHA or the THA. There's a new administrator, which is like the equivalent to the PS. So that was also useful. General topics were discussed, how we could continue to assist Tobago. So there's a general introductory meeting, and then the technical people will continue to meet as they have done regardless of who is in power at the THA, and we continue to work with the THA and the TRHA as Trinidad and Tobago fights this global pandemic. So there's a very productive meeting, and I'm glad I instituted it. Thank you very much.
Thank you, Minister. AZP News, we are ready for your follow-up question.
Good morning again. Minister, if the public service becomes a safe zone very shortly and we still have unvaccinated nurses, healthcare workers, etc., is there any plan the ministry has now to put in place for that? Because there will be a shortage of staff, of course. What plans are there?
Thank you. So at the start of this initiative, each RHA engaged the executive management team in scenario planning. The scenarios are going to be different from RHA to RHA, and let me explain. So if an RHA, like let's say Southwest, say that their staff is 80% vaccinated, what they are now drilling down into is which department needs to be vaccinated. Is it HR? Is it transport? Is it the nursing pool? Is it, and that is what they are doing now. And it will not be a one-size-fits-all, because different RHAs, when you break it down by department, which is what they have been engaged with since last week, to see where the vaccination hesitancy lies. Is it in pharmacy services? Is it in biomedical engineering? Is it in radiation? So that is what they are doing now, and each RHA will engage in scenario planning.
Thank you very much, Minister. We now go to TV6 for your question.
Okay, thank you so much. My question is for the Minister, and it's a follow-up question to Rashad's question. Minister, it's better for people to know beforehand whether what they're about to do is breaking the law or whether, instead of actually doing it and not knowing what they're doing. So I wanted to find out, is operating a party boat under the regulations, whether you say, if you're operating it as a floating restaurant, quote unquote, floating restaurants, is it against the law? Is it permitted? How does the closure of beaches at 12 p.m. daily affect that operation and so on? Can you provide some clarity on that so that people would actually know?
Yeah. So because this matter is with the TTPS and the DPP, I advise everyone to read Section 8 of the regulations for clarity. So that takes care of that. No one needs to apply to the minister to operate a safe zone. No one needs permission. I would advise anyone who wants to operate as a safe zone, whether it's a party boat or not, to seek their own independent legal advice. That's the best advice I can give them. On the issue of beaches, I'm having a little challenge. CMO, do you understand this thing about the beaches and the party and the boats? You mean access to the boats? Alicia?
I meant as beaches close off at a particular time.
Right.
I know that recreation activities weren't allowed. I don't know if a floating restaurant would be considered recreation or if it would be considered business like fishermen, but I just wanted some clarity in relation to having a floating restaurant and so on.
And that's why I said I think each person now has a duty to seek legal advice as to what they are doing. All businesses should be able to seek legal advice, read the regulations, and be guided by sound legal advice that you have engaged. That's the best advice I can give any operator of any safe zone facility. Seek your own legal advice. Retain an attorney and seek legal advice.
Thank you, Minister. We will now take a question from the Express.
Good morning again, Camille Hunt Express. My question is just an add-on to previous question where he asked about what grade would the minister give himself on managing the pandemic. I'm asking not for a grade, but what is your overall assessment of how Trinidad and Tobago has handled the pandemic in 2021? You know, looking back now that the year is ending, what have we done well, or what could we have done differently, and what lessons are we carrying into 2022?
Yeah, thanks. So, overall assessment, I would think we have done, as a small country with limited resources, I think we have done extremely well. Our first duty was to protect healthcare workers by the provision of PPE. Trinidad and Tobago is one of the few countries in the world that never ran out of high-quality, appropriate PPE. 2, we set up the parallel healthcare system, over 1,000 beds. We will never know how many lives have been saved. We will never know how many lives have been saved by the setting up of that parallel healthcare system. Key supplies were never jeopardized, as in other countries that ran out of things like oxygen. We ensured that key consumables were always present. We never ran out of test kits. We procured vaccines, WHO-approved vaccines. We started our vaccination program in February of 2021. To date, we have vaccinated 666,432 persons. Not enough, admittedly, but 666,000 persons are now better protected. We have paid all healthcare workers on time. Many countries couldn't do that. That were similarly resourced. We managed our borders well and were criticized for it. So we did everything that this new pandemic posed to us. The world, together with Trinidad and Tobago, was literally flying the plane and building it at the same time. The CMO and I often engage in this coulda, shoulda, woulda. Everything that we did at the time, based on the information that we had at the time, I think we were spot on. But the ingredient that we need now, more than ever, is personal responsibility to stop unnecessary gatherings. The front page picture in The Guardian on Boxing Day of that throng, those crowds of people with babies unmasked, children unmasked, how do you account for that? So I think as a Ministry of Health, we have done everything that we could have done, but what we need now is a higher degree of personal responsibility as we move in together with the rest of the world into year 3 of this pandemic. So thank you very much for the question.
Thank you, Minister. I will pause to take a couple questions from Matt, the Media Association of Trinidad and Tobago. And the first question is, can you provide an update on Omicron patient 0, both health and legal status? CMO?
Yeah, so the legal part of it is on the investigation by the Trinidad and Tobago Police Service. In terms of health, when I answered the question about the 11 cases, they all remain mild to moderate in terms of status and doing well.
Okay, thank you. Second question. Please provide an update on the health of the patients who are being monitored for vaccine-induced thrombocytopenia thrombosis.
Okay, yeah, so it was quite a while ago actually that we wouldn't have had a case of that particular syndrome. But last I had updates from Dr. Charles, who is our hematologist assigned to the ministry. Patients were following the WHO guidelines in terms of the protocol for treatment, and I haven't heard any adverse events thereafter occurring in terms of their status.
Okay, thank you. Another question. State Media House TTT recently aired a news story about a Christmas Day football sweat, and the report mentioned nothing about football sweat being banned. Are team sports like football sweats allowed?
I think I'll have to go into the regulations. I think what is allowed is training for national teams, but I don't think non-national teams are supposed to be out and about playing sport. Okay. You remember, public gatherings are limited to 10. Restriction of certain activities, section 4, we could check there. So let's move on to another question, and I'll see if I can find the answer for that one.
Right. The next question refers to PM Gonzalez's announcement that Cuban vaccines will be offered as part of that country's pandemic protocol. What is Trinidad and Tobago's position on Cuban vaccines? CMO?
Yeah, I could go ahead. I mean, at the end of the day, I think the government policy is clear and has been overstated that the WHO approved vaccines are the ones we use in Trinidad and Tobago.
Okay, thank you very much. So we will then move back to Guardian Media Limited. We are ready for your follow-up question.
All right, Minister. I'm not quite satisfied with that response you gave to Alicia, because she did raise a very valid question that people need to know before they engage in doing something. Now, Minister, I mean, all due respect, if I publish an article tomorrow and you call me for clarification and I tell you ask Al because I don't know, I mean, that seems a bit contradictory. I mean, and after all, you as well as the Ministry of Health would have formed the basis of these regulations. So, I mean, could we have some more clarity on that?
Okay, so as I said, any entity that wants to look into the issue of safe zones, and I think the issue that has been raised is one that needs interpretation, and that is why I said the matter is currently before the DPP. And that is why I have been advised by the lawyers not to say too much, because it is before the DPP and the Trinidad and Tobago Police Service. And if anyone who is in doubt as to what they need to do to comply with the safe zone requirements, I also suggest that they get legal advice to do just that. So the DPP and the TTPS will bring some level of clarity if there is clarity to be brought. Okay, so I hope that that gives some more clarity to the issue, and let the DPP and the TTPS resolve the issue.
Thank you, Minister. We go back to the Newsday for your follow-up question.
Hi, good morning. Going back to the question of boosters, we've received reports that people are being turned away from getting boosters because they came a couple of days early, like literally 2 days early based on their date of second immunization. Does this make a difference medically?
So generally, a couple of days wouldn't make a significant difference, and we have advised through the CEOs when we met with them that, I mean, there needs to be some level of discretion at the healthcare workers level, right? So if somebody comes 1 day before you get to 6 months, there should be some discretion applied. There's no clinical reason to say no to that particular individual, but the policy does speak to 6 months post your second dose.
And let me just add, once we start to make exemptions, then what happens? All 600,000 persons who think they are due for their vaccines will descend upon us, and the system will collapse. So it's not a matter of clinical judgment. It's a matter of making sure that people come in an orderly fashion, depending on when last they get there. Because if word starts to get out that we are making exceptions, you are going to have 100,000 people descending on the system at the same time, and then everybody will call for my neck. Okay, thank you very much.
Okay, our final question goes to Ms. Boucher, TV6.
Thank you so much. My question is for the CMO. Actually, I have a question and a request. So the question, CMO, I saw, I believe in the last week a study was done in China stating that out of that study, now a lot of media would have published this, including Reuters and so on, that the booster for Sinopharm is not as effective as the boosters for other vaccines against the Omicron variant. And I was wondering if you saw those reports and what you thought about it. And the request, I saw that Alzheimer's has been added to the list of comorbidities. And I was wondering if you could have someone come on and explain the link between Alzheimer's and COVID-19 severity and so on, and morbidity. Thank you so much.
The first question related to Sinopharm. I think Sinopharm, along with other vaccine manufacturers across the world, are trying to not redo, but repurpose their formulations to deal with the Omicron variant. It is such a different variant from the original Wuhan lineage in terms of the number of mutations that is on it. So 28 to 32 mutations on the spike protein is quite a large number of variations. So it's significantly different. But I have gotten indication from them that they are looking at the formulation as well to deal with this particular variant. Again, just like any other vaccine has been doing, I think Pfizer had said the same thing. Moderna has said the same thing as well. In terms of Alzheimer's, as a disease, it's a neurological illness. However, because of the nature of it, it poses a threat not only from the disease itself. Persons are not able to do public health regulations and guidelines as much. They're not able to wear masking, for example, in terms of the general hygiene and general way you carry yourself with that particular disease. It poses a threat, greater risk of infection, and then persons are not able to take care of themselves when they get infected. So it poses a greater general risk. So it can be treated as an additional risk factor, and of course can lead to complications and sequelae, just especially neurological complications that can occur.
Thank you, CMO, for that clarification. We go back to the Honorable Minister for closing remarks.
Thank you very much, Al. And thank you very much, ladies and gentlemen. I think we got to ask quite a few follow-ups because we kept it short and brief, our presentations. Thank you again. As we come to the end of 2021, this is most likely the last press conference for 2021. I would like to thank all members of the media for working with us, carrying the stories. I want to wish everyone a very happy new year. But as we say that, I want to implore the population that this weekend is one that if I read a statement from Dr. Tedros, I think he made a very wise statement. And he said, an event cancelled is better than a life cancelled. Wow. That is Dr. Tedros. An event cancelled is better than a life cancelled. I am imploring persons that not to repeat what we saw over the Christmas weekend. We are now on the lookout for a surge in cases because of Christmas activities. You saw it in the newspapers and you saw it there from about the end of the first week in January. Please don't add to the burden of the healthcare system by overdoing Old Year's Night this year. Let us all be very, very circumspect in our activities. Don't gather. Please, we are imploring you, don't gather. Don't take off your mask in indoor setting amongst persons that you don't know. Avoid the Old Year's Night, big lines, parties, ring in the new year very, very quietly this year. And please spare a thought for our healthcare workers who will have to try to provide you with healthcare services by the first week in January, end of the first week into the middle of January end. We're in a very difficult phase, and I'm just urging caution. Have a safe and prosperous and healthy 2022. To ladies and gentlemen of the media, I wish you all the best for 2022. Thank you very much.
And thank you, Honorable Minister. We will leave you now with a short video from one of our own, David Rudder, endorsing the COVID-19 vaccine. Goodbye and be safe.
I am David Rudder, and this is my story. I was in Belmont with my family. That's where I was born.